Okay, I'd like to call the August 2025 Human Services Committee meeting to order. The first item up is the approval of the minutes. Do I have a motion to approve the minutes?
So moved?
Do I have a second?
Here.
All in favor?
Aye.
Anyone opposed? Okay, those carried. Do we have anyone to speak to the privilege of the floor? Anyone to speak to the privilege of the floor? Seeing none, I'll go to the first proposed resolution to confirm reappointments for the Chautauqua Opportunities Board of Directors.
James Feldman from the County Executive's Office. So this resolution is to reappoint the two members that want to stay on the board. So for the COI Board of Directors, they vote on it internally and give us a list of names, and then we go from that. So these are the two reappointments. There are going to be 4 other public sector appointments as well, but they're all new appointments, and their bio forms weren't in time for the pre-file deadline. So we're going to be putting those through next month. But so this month it's just doing the 2 reappointments.
Okay. Does anybody have any questions or concerns?
So if someone's interested, how do they get on that list to be reviewed or interviewed?
The COI has an application process, so you apply to COI and they do interviews and then hold an internal vote on who they want to recommend to the county.
Thank you.
I think these are good recommendations, and I support these candidates.
Okay, all in favor?
Aye.
Aye.
Anyone opposed? Motion carries. Number 2, proposed resolution is to authorize a grant application for 2025 CDBG funding through the New York State Office of Community Renewal, Septic and Wells Program.
Good evening, folks. I'm Jessica Worsley, Director of Environmental Health for Chautauqua County. This resolution is to authorize the application that we'd like to put in for the next round of CDBG funding that assists low and moderate income folks with septic system and well replacements. At the full legislature meeting next week, I'll be doing the first public hearing, which is a required part of this application process. And then this resolution will hopefully be later in your agenda, so you'll be able to ask me a plethora of questions, and we'll be able to hear the public's questions at that public hearing forum.
Any questions from the committee? Comments?
It's a good program
And needed.
and needed.
Yes, I agree. All in favor?
Aye.
Anyone opposed? Motion carries.
Thank you, folks.
Thank you. Number 3 is proposed resolution authorizing and approving settlement agreement and action relating to the opioid crisis, Sandoz, Inc.
Good afternoon. I'm Morgan County Attorney. I am here before you today both on proposed resolution number 3 and number 4. They are similar in the sense that they are both proposing that the county executive and myself are authorized to enter into a potential settlement for the, we call it the opioid crisis. We basically have one resolution for Sandoz Inc. and another resolution for a group of smaller manufacturers that were sued on a national level. There were claims that their practices and their acts contributed to the opioid issues we are all experiencing nationwide. Yes.
Is this like the same thing as when we had the tobacco settlement years ago?
Yes,
Same
it is.
idea?
It's very similar,
Like
yes.
it's paying back the government for wrongs
Basically.
done to our citizens?
Yes.
Okay.
Yes, right now they agreed to basically put $99 million into a settlement fund. We have until September 30th to declare our participation in a potential settlement. We don't know how much we're gonna get at this point. That's something, there's formula that does get applied later. There's a settlement referee that will take a look at, you know, what is just, what is fair, what we can claim. But right now, we need your approval to drop the litigation essentially and say, you know what, let's participate in this settlement if it works for us. Let's go ahead and, you know, cut the litigation costs, let's see what money we can get, and take it from there. Any other questions?
Are we at the tail end of this? This has been ongoing for a while.
Yes, and there's been various other companies as well, from Walgreens to, you
Mhm.
know, other
I remember that.
distributors. I know when I came over, we were already receiving certain funds. I checked their website this afternoon, there's probably another 10, 15 open. I'll be honest with you, I don't know. It's one of those, when you settle with a lot of these companies, that's it for them. But is something else gonna come up? Are they gonna continue doing what they're doing? Are they gonna do something else that we think is gonna be worth litigating? Who knows? It's one of those where with nationwide litigations like this, everybody jumps on, as soon as they can. If you're a city, if you're a tribe, if you're a county, you wanna get involved because we're all impacted by this. How much we're gonna get in the end, we don't know, but we do know now that there's a fund at least that can be, you know, sliced some way to get something. Because it's a nationwide litigation, it doesn't make sense for us not to jump on the settlement train and say, you know what, County of Chautauqua is just gonna go and litigate this ourselves, because the cost of that would be astronomical. So we're kinda keeping together within our subdivision, litigation subdivision, within our group, and kind of all doing the same thing.
So will eventually get trickled down to an individual, see some money, actual see some money?
That's a great question. At this stage, I don't know for these two. That would be fantastic, that would be great. That would probably
And
be
if so, who
helpful.
determines that?
Right, that would be helpful, but at this point, it's, you know, pinning them into realizing that there's some level of liability or responsibility, and then recognizing it by paying up.
But that's not from our end, what we're doing here.
We're not
That
paying
would be-
anything.
We're
I
agreeing to
know.
jump on.
Sure.
We're agreeing to jump on, I get
Yep.
it, but the individual, if an individual, then they would have to litigate or join a class action. That's what you're talking about, or am I mistaken?
Yes, what I'm saying is, right now, we don't know. Maybe this all goes into thin air, to be quite honest with you. Maybe once we say, you know what, let's start negotiating, let's see what you guys have, maybe the settlement doesn't even go through. And maybe we say, let's go ahead with the litigation. In this particular stage, I can't guess. I don't want to guess, I don't know. That's what I'm trying to tell you. I don't even know the numbers, let alone what we might do with those numbers later. So right now, all I'm asking for you is to approve that we can
Jump on.
jump on the settlement bandwagon, basically, and see what comes out of it. Mm,
Any other questions?
Nope.
All in favor?
Aye.
Anyone opposed? Okay, number 4, authorizing and approving settlement agreement in actions relating to the opioid crisis, Alvogen, Inc., Amneal Pharmaceuticals, Inc., Apotex, Inc., Hikma Pharmaceuticals USA, Inc., Indivior, Inc., Mylan Pharmaceuticals, Inc., Sun Pharmaceuticals Industries, Inc., and Zydus Pharmaceuticals USA, Inc.
Yes, so this is essentially the same request, but all of these companies that you just read on the record are basically a group of smaller manufacturers, and they're all kind of bundled together for this one resolution that, again, asks the same thing. Please allow us to enter into a settlement process and see what we can get out of it.
Any questions on this one? Okay, all in favor?
Aye.
Anyone opposed? Carries.
Thank you very much.
Thank you.
Who's coming down next?
Number 5, to authorize a lease agreement with Town of Chautauqua for office space for Chautauqua County Department of Mental Hygiene.
Good evening, Carmelo Hernandez, Commissioner of Mental Hygiene and Social Services. So 2026 will be the year of innovation, and we're just getting ahead of it on our end here in Department of Mental Hygiene and Social Services. So this lease agreement will be for the 3rd floor in City Hall, and we'll be able to combine and consolidate a real interdisciplinary team. It'll be our mobile crisis team, our homeless unit, members from the home-based community services team, and also court navigators. So It's twofold. One way, it gives us opportunity to get ahead and consolidate some of our lease agreements and also payment, so it helps us fiscally, but most importantly, it helps us in terms of services. These teams work very close together, so it help us become more efficient in what they do day in and day out.
Efficient's the key word right there.
Absolutely.
So this is a new lease then?
Yes,
For new space?
yes.
Additional space?
Yes, but we will be reducing because the mobile crisis team right now has their own lease, or their own space. The homeless team has their own space, and the home-based community services team, they don't have a space, and the court navigators don't either. So instead of having multiple 4 or 5 spaces, we're consolidating them into one because they're not client-facing. We can go to where the clients are needed, either in the 5th floor in City Hall or in SCOB.
Okay.
We
So,
didn't save any money on this one?
that's
We're
Yes,
saving
we
rent?
would.
Do we know
Yeah.
how much we're saving?
I could get you the numbers and I can have it ready for you tomorrow morning.
So this is, we're talking about the city of Jamestown's number 6, and the town of Chautauqua is number 5. Are we talking about 5 or 6?
Good question.
Yeah,
That's-
exactly.
That's a great question, because for me, I'm talking about City
Number
City
6?
Hall.
Okay.
Yes.
Okay.
But we're gonna save money.
Yes, that's why I called it. So one of the things that we've been harping on the mental hygiene and social services
Right.
side is everybody knows all the things that are coming up ahead, but it's being innovative and being effective and efficient. I'm actually excited because it gives us opportunities to do things different and to be the first, and I'm always going to be excited for that. But that's one of the reasons we came and we jumped on this, to get it moving and not wait for the state to tell us what it's going to be, even though we will find out, but it's a great way to just become better and efficient.
So for Mayville specifically, everything you just said applies to Mayville on number 5.
There's no
We're
homeless
on
in
number
Mayville.
5.
We're on,
Are we?
we're on Mayville.
Yeah, we're on number
Town of
5.
Chautauqua,
But we can do number 6, right?
Chautauqua County Department of
Well,
Mental
he
Hygiene.
then go
didn't take
back
it
to
out of
5?
order.
Yeah,
So number 5 is authorized lease agreement with the town of Chautauqua for space for Chautauqua County.
that's
Health
the
Department.
a regular one that we already always had since I've been here. Number 5.
Okay,
Yeah,
so
that,
this is
Continuation of. a
yes,
continuation.
continuation of what we've already had. I jumped the gun and I went to number 6.
because I asked if this was new space or continue.
Yeah, number 5 is continued. Number 6 would be new, but also reducing footprint.
Okay.
So for number 6,
Let's stay on number 5.
okay.
Yes.
Let's stay on number 5.
Who's on first?
Okay.
Number 5,
Yes,
Mayville, New York.
yes, that's 2 Academy, yes.
Yeah, okay. The rent is the same
Yes,
as it was in previous?
the rent is the same. I believe, I'll get you the numbers, but I believe the increase is only like by 2%. It's not a huge increase.
Okay. So it is an increase though?
It says,
Yes,
the resolution says, since the lease rate will remain the same.
That's what I thought I read. This is included in the 2025 budget, and an amendment is not needed. And this is the term of 25 through 28. So according to this, it's
and that's
not
the,
increasing
yeah, and that's the 2 Academy on the 2nd floor, yes.
on Mayville.
201, yep.
Okay. Same amount of space,
Yes, same amount of space.
same dollar amount,
Yes,
and same services, nothing's being combined there, it's the
no, nothing's
same
being combined here.
tenants.
Absolutely.
Same-
That's basically our, we could call it our administrative headquarters for mental
Mental
hygiene
hygiene, right.
specifically.
Okay. Are we clear?
Yes, indeed.
Okay, are there questions on Mayville, number 5?
None.
Okay, all in favor of number 5?
Aye.
Aye. Opposed? Carried. Number 6, now let me read it for the record. Authorize a lease agreement with City of Jamestown for office space for Chautauqua County Department of Mental Hygiene and Social Services. Everything you said
Yes.
previously. New space,
Yes,
combined space,
yes,
overall cheaper, 3 different leases combined into one lease, which is cheaper. correct? No, I'm goofed up.
No, he already said that before when we thought we were on number 6.
Yeah,
I jumped the gun.
right. So we are going to do 2,180
Square
square feet.
feet. Yes.
Do you know what we were at before, approximate square footage, or?
No, but I could get you it from,
It's less.
yeah, most definitely, because we were at Warwick, so that team will be coming and combining with the homeless unit and the court navigators haven't been hired yet, but we would have had to look for space for them, but now we have space for them. That would be right there.
Are we locked into this for the 5 years, or could it be terminated at any point?
We have a great relationship with the city of Jamestown. So right now, our 5th floor
5 years.
is at 5 years. So we figured let's make them look equal and identical since we're already providing services there.
Okay. Any other questions or comments on number 6 for Jamestown? Okay. All in favor?
Aye.
Aye. Opposed? Carries. Thank you, Carmel. Number 7, authorized lease agreement with SUNY Fredonia for 2026 Senior Expo event.
Good evening, Dana Corwin, Director at the Chautauqua County Office for Aging Services. Number 7, we're looking to repeat
Fredonia.
for 2026, the CHQ Aging Expo and Conference. It's an excellent spot, a lot of great feedback. We are pretty much set for the lineup next year. We just need the resolution for the one-day lease agreement of the space at SUNY Fredonia at the Williams Center.
Okay. And this is all probably the same terms?
Hopefully no rain this year.
No what?
It rained all day
Oh, yeah.
last year, but we had a great turnout.
And it was successful.
It was.
That's good.
It's a nice venue.
It really was. The rain was tough, so we've made some, preliminary arrangements to change of the order of the day to account for food and space, but it was a great first effort, and we had close to, I think, between 550 and 600 people there, along with just under 100 vendors.
Do you plan on expanding it at all?
We
Thinking?
could, we'll have to really wrap around the building. So this year, after seeing how many people gravitate towards certain areas, we'll be spacing it out a little bit better. Particularly with the food trucks that we had in place there.
Oh, okay.
It just poured rain and there was no way to avoid the rain. Yes,
Dana,
ma'am.
I have a question. Is there any opportunity to do this in the South County?
We looked in the South County, and the opportunity across the county for a venue that large is SUNY Fredonia. Then it comes to here at the Chautauqua Suites, possibly the institution, off-season, and then JCC. At the time, none of the other venues would really work, and we had such a success there that we wanted to build on that. We also offered transportation via the trolleys with the CHQ Transit that took people from the south part of the county all the way up to the north in 3 corridors, straight up, east, west, and mid. So we felt like we were pretty successful. People have started talking about it word of mouth. Hey, I rode the trolley the whole way there. So it worked out very nice. But JCC wasn't interested at the time, and they didn't indicate interest the next year. It's in May, so it's a little bit of a transition during the time they shut down for the semester. JCC just had, I think, a larger staff, and a staff really kind of centered around outside entities coming in for that time frame.
Okay, thank you.
Do you have any idea who attended, the demographics? Was there a lot of people from the South County that came?
There were. We did a survey. I don't have it, but I can certainly follow up with you, and it will give us pretty much the zip code from what I understand.
Oh, okay.
So we did an automated survey of our Blooming Health platform, which allows people to give feedback on the event.
Yeah, that'd be interesting. Any other questions or comments? Okay, all in favor?
Aye.
Aye. Anyone opposed? Carries.
Thank you.
Thank you. Number 8, proposed resolution authorize acceptance of 2025 Exhale Grant Award.
This is an extension of the Alzheimer's Disease Incentive Program, the ADCSI, the Caregiver Support Initiative, rather. We've had this grant in place for a number of years. This is extra funds that I understand that they got through a foundation that they're looking to disperse through the counties, particularly in the western New York. So our allotment would be $5,000 additional dollars to provide respite services for caregivers and people affected with cognitive impairment that need assistance, either in-home or respite days at adult day, even overnight respite in some nursing facilities. It's nothing new. Our contracts are all in place, so there's no additional work. It's just extra money to provide that service.
Is that for just the rest of 2025? Okay.
And we should be hearing, of course, we go through the resolution, but it probably will be received close to probably the middle of the fourth quarter of this year. But
Okay.
we feel like we should be able to expend the monies.
Do you have to expend the monies by
I
December?
don't know the date right off the top of my head. I'll double check and
Okay.
see when that end date is.
And you said this is on top of what's already been.
Mhm.
Any other questions? Comments?
It has been a wonderful opportunity to offer folks that are direct caregivers for people with cognitive impairments, dementia, and Alzheimer's, the opportunity to spend 7 days in a facility for respite. Some of our caregivers have said, it allowed me to go visit family otherwise, in other places. It has allowed me to have some outpatient surgery and take time to rest and recover. So it's been a really successful program to get people into the overnight respite in the county. And we are working in North County to replicate that with some facilities.
How many people does it, I mean, is it?
If it was straight
over.
overnight respite, it's about $1,200 a week. So
Okay.
it's just a couple more.
Okay,
So we don't feel like it would be a real hardship to get those people and those monies expended in the time period that we'll have.
yeah, sure.
And then if we're able to put together a contract in the north part of the county, that would be great too.
Okay. All in favor?
Aye.
Opposed? Carries. Number 9 is proposed resolution is to authorize Office for Aging Services and Department of Social Services to submit application for New York Connects funding on an annual basis.
Mhm. This is an annual application for this shared program from DSS and OFA to provide the New York Connects program, which is a helpline, a walk-in, aging and disability resource center. It's been in place since 2006 and has required to have an annual application done every year. In the transition in leadership, in conversations with our legal department, we felt that the resolution put forth so that it went on for every year would kind of take away the difficulty of getting the document processed. Many times from the state, we'll get an application on the 17th of the month, and it's due on the 1st of the next month. So the challenge is turning that around in the system.
Any questions?
Congratulations on the efficient use of your time and our time.
I have
Yeah.
one more coming next month for that, too. Yeah, we're working on that.
That's great. All in favor?
Aye.
Opposed? Motion carries.
Thank you. Have a good evening.
Number 10, proposed resolution authorize agreements with the governmental entities for emergency assistance facilities and training.
Good evening.
Good evening.
Lacey Wilson, Public Health Director. I'm here on behalf of this resolution. This is really sort of a reauthorization of this agreement. These are entered into typically by region and allow us to work efficiently with other counties if there were to be a public health emergency or a disaster, so that we can collectively be reimbursed, through aid or grants. Oftentimes maybe needing to share staff and be able to, pass reimbursement or payment back and forth between the counties.
For the specific counties, what count, just our region? our
It's
area?
the western, it's the western New York region.
All right.
So I think, this is part of sort of that rotating resolution timeline where they want us looking at the resolutions, you know, every so often and making sure all of the language is up to date and that sort of thing. So I think this one with the Western New York counties is on either like a 3 or 5 year cycle, so we're right in that timeline to renew.
Okay. Any questions?
Mr. Chairman, I have a question for Lacey. When I read this resolution, it talks about disasters, and it sounds like you're talking about public health emergencies.
Which go hand in hand. And so typically the staff that we would share during disasters, so if there were, you know, some sort of flooding or water disaster, there's exposures that can occur that would affect people's health and the public's health, so that we would bring, you know, nurses in or a staff of clinicians that may need to do vaccinations or clinical assessments on individuals to ensure, you know, that they don't need further medical care, that sort of thing. This really originated when one of the more northern Western New York counties, there was a hepatitis outbreak, and they needed additional staff to come and vaccinate, you know, large quantities of people. So in order to, you know, share staff to be able to do that and reimburse between the counties, you know, they had a difficult time doing that because an agreement like this was not in place. But other, you know, issues as well in terms of, you know, large fires or structural fires or things like that, bringing in public health clinicians and staff. Chemical spills is another disaster that, you know, you may see where we need to bring in public health staff from other counties to help with the environmental side of cleanup and, you know, properly containing disasters like that. So we're very lucky to have such great partners in our EMS department, but we do plan very closely with them because this work does go hand in hand.
Okay. So it wasn't perfectly clear in reading the resolution that this only pertained to public health. When I hear about disasters, I think, what if we have a major snowstorm and it's declared a disaster?
Right.
Would this give us the ability to bring in equipment from other areas to help plow the snow or move the snow?
Right.
But this is specific to public health.
Well, that's actually a really great question, because, you know, this language comes to us from the Western New York Consortium of counties. And because all of the counties are different in their structures in public health, you know, not every county has, you know, an established EMS division or so on. So that's actually a great question that we should clarify with legal, if this could extend to other departments. You know, that's not something that I'm aware of.
Okay. Thank you.
I guess kind of to tag along on Chairman Shagnon's question, it does say upon the threat or occurrence of a disaster in the second whereas, so it's only health emergencies from disasters, or is it, or public health? You said hepatitis in the northern county, which is not a disaster.
Right. Public health emergency, right. Mhm.
It's, yeah, it's public health, so.
Right.
With
Yeah.
that,
That's, yeah, I think
'cause this is,
we will definitely clarify that with legal and see if this does open up. I mean, I have a sense that the language may be more broad to allow there to be such, you know, agreements made between counties. Really, the intent of the resolution and the agreement is to ensure that we have the most efficient ways of working together. So I would not see why it couldn't, other than typically when there is either a declared disaster or public emergency, public health emergency. You know, those are FEMA monies or other emergency grant monies that, you know, the state really sort of dictates what that funding can be used to reimburse. But there certainly are snow emergencies declared and things like that. So we will absolutely clarify that with legal to see if that is something that, you know, we can extend.
okay.
But it is us today. It typically does fall under the guise of public health, so it is me here today, but
Yeah.
yeah, it certainly could extend beyond that.
Great.
Okay, any other questions, comments? Okay, all in favor?
Aye.
Aye. Opposed? Carries.
Thank you.
That brings us to the other portion. Is there any other business we need to attend to? If not, I would entertain a motion to adjourn the meeting. Second,
Second.
all in favor?
Aye.
That is adjourned. We are adjourned.
I don't think that mic was working, because I
I think
struck.
that microphone's only working for, him.